Hello and welcome to Drug Talk. I'm Matt Hamilton and today we're talking about the drug Aciphex, how it affects the human body, how mistakes are made with that, the consequences of those mistakes, and what you should do as a patient or a loved one if you've discovered one. As you know, I'm a trial attorney. I specialize in drug error cases. I'm here today joined by Dr. Jesse Garcia. Welcome, Dr. Garcia.
How are you?
Doctor, what is your area of specialty?
Well, I'm a clinical pharmacist. I specialize in drug interactions and the effects of those drugs on the human body.
Now, Aciphex, it has a generic name as well. Is that correct?
Correct. Recently went generic. I say recently, within the last year and a half. The name of it would be Rabeprazole.
Okay. Now, Rabeprazole or Aciphex, what does it do in the human body?
It is in a class of drugs called proton pump inhibitors. Essentially, the function is to decrease the body's ability to produce acid that then is secreted into the stomach.
I see. Okay. So people are taking this because they have acid reflux or some other sort of stomach problems relating to the acid.
Correct. You might see it used for acid reflux, heartburn, as you might know it as. The other issues that you might see would be ulcerations of the stomach lining. They would use that to decrease the amount of acid that's being produced.
Okay. So you've got doctors prescribing and you've got pharmacists filling Rabeprazole or Aciphex. Can mistakes happen in getting the drug to the patient?
The way that this drug is intended to be used is, in most cases, all of the proton pump inhibitors are intended to be used for a short period of time. Okay. Usually, you're looking at a 14-day therapy for a mild case, and then it can continue on for up to 3 months, typically is what you see as the typical length of time on the maximum side.
So when are they taking it too long?
So I would say about 90 days would probably be the maximum amount of time you would want to take it. Anything beyond that then puts you at certain risks that we'll discuss here shortly. Now, there are certain cases where you want to do that, but by and large, you're going to see it used for a shorter period of time because it's typically used as a symptomatic treatment. You treat it now and then don't use it basically as a maintenance drug.
Well, Dr. Garcia, it's normal for people to have multiple drugs that they might be prescribed by their doctor that they're taking, or perhaps an over-the-counter. Are there any drug-on-drug interactions with Rabeprazole or Aciphex?
Correct. Most of these drugs do have direct drug interactions. The other, where basically two drugs don't mix together. The other thing that you see in some cases is you'll see where the drug can affect the way another drug works, okay? Meaning maybe they don't go together directly, or you might decrease the amount of acid in the stomach and thereby prohibiting you from absorbing calcium. So calcium, you typically want an acidic environment to have absorption of calcium. And so you don't have as good as absorption because the lower levels of acid that are produced.
Gotcha. Are there any pre-existing health conditions that might affect somebody taking Aciphex or Rabeprazole?
With Rabeprazole, you want to make sure you're doing some kidney function test. In this case, would be liver function test to make sure that the liver is functioning properly. In some cases, what we've seen is concentrations or amount of the drug that's in the blood actually up to doubling based on decreased liver function.
Gotcha. Are there any unusual, I've heard that race can be an issue with Aciphex.
With Aciphex specifically, we see that there are certain cases. So for instance, Japanese males in particular, and it's based on genetics and the way that the Japanese males have a certain concentration of drug enzymes that help break the drug down. So in some cases, those are lower in that patient population. So if you can't break down the drug as quickly as, say, you or I might be able to, you would see those concentration levels of the drug in the blood increase.
So if you're a patient and you're taking Aciphex or Rabeprazole and you've been taking it well over 90 days, or you're having some sort of concerns about interactions, or there's a race issue or a liver problem, what sort of consequences would the patient face?
Well, class-wide, what we see, when I say class-wide, basically all of the proton pump inhibitors, and Rabeprazole is one of those, We can see what's called interstitial nephritis, which is basically the inner lining of the tubules within the kidney can become inflamed. Untreated can cause some long-term problems. Chronic kidney disease is one of them that we can see. Eventually, end-stage renal disease if it's not caught. The other problems that you might see is you might see an issue where you're not absorbing calcium as well, like we stated earlier. And so what that might result in is possibly an increased risk of fractures. Some of that.
Well, you talked about if they have a pre-existing liver problem. Would one of the consequences affect the liver?
In this case, you wouldn't necessarily see liver problems with it. You would think if you had pre-existing, then you could possibly have that. Now, one thing that you might see is lupus, which is an actual skin condition. And in that case, you'd see, kind of typical symptoms of that. There's a few different types of lupus. The one that you would mostly see associated with this would be one called SLE, systematic lupus erythematosus.
Okay.
So, that's what we would see with this one, which would be characterized by, kind of patches of just basically red patches on the skin.
Okay. Are there any infection risks with Aciphex?
Correct. What we see with Aciphex and class-wide, again, is something that came out in 2016 that basically said use of these types of medications can increase your risk of C.Diff, which is basically an infection, bacterial infection that can get into the colon and wreak havoc. It's very difficult to
If somebody's
control.
concerned as to whether or not they have C. diff, how might they know that?
You would have extreme diarrhea, and it would have a very, very foul and distinct smell to it. It has to be treated in the hospital and has to be treated very quickly because it can progress. And there are a lot of precautions that need to be taken with C. diff cases.
Well, if you're somebody that's taking Aciphex or Rabeprazole and you seem to have some of these symptoms, is it something they can delay on?
Well, we're talking about kidney function when we're talking about the ability or the drug's potential for causing those problems. Those would be symptoms like blood in the urine. You would feel almost like if you had a kidney infection. C. diff would be diarrhea that was pretty much uncontrolled. So those are symptoms that you would definitely want to seek out medical attention immediately.
Okay. And by immediately, you mean call the doctor the next day? Or
in those cases, you would want to get seen.
Like emergency room type stuff?
Emergency room, urgent care, you want to get seen now.
Okay, right away.
Correct.
Okay, all right. Well, Dr. Garcia, it's been informative. Thank you for talking about Aciphex and Rabeprazole with us. If anyone at home would like additional information, they can go see our website at worldwideweb.law-kc.com, or they can look at our YouTube channel for additional videos. Dr. Garcia, thank you for being with us today.
Thank you.
And we'll talk to you soon.
Absolutely.